For reasons that utterly escape everyone involved, you're listening to a bipolar, a schizophrenic, and a podcast. Here are your hosts, Gabe Howard and Michelle Hammer.
Hi, welcome to a bipolar, a schizophrenic, and a podcast. I'm Michelle. I have schizophrenia.
I'm Gabe. I have bipolar disorder, and I am excited to tell you about Michelle's nomination to the WEGO Health Awards. Because it's not just Michelle's. It's the entire podcast. A bipolar, a schizophrenic, and a podcast was nominated for Best in Show Podcast because of our fearless schizophrenic host, Michelle Hammer.
That's me. I'm fearless. Except of cockroaches.
Cockroaches are terrifying. How do people endorse us? You only have to endorse once, so you just have to follow this link. There'll be a little endorsement button. You click it. You have to enter like your name and email address. It's not very scary. And then the number goes one higher than it was before. And those numbers help determine the winner. Michelle, how do they do that?
All you have to do is go to schizophrenic.NYC/WEGO. It's WEGO.
That's it?
Yes.
So if anybody doesn't do that, it just really means that they don't like you.
Well, then why are you listening to me? That's so mean. Gabe, how was your week?
Well, as you know, Michelle, my father-in-law passed away in the last couple of weeks.
I'm really sorry about that, Gabe. I feel so terrible. I mean, I know that your father-in-law is the same age as my father, so that really kind of hurt me as well, just thinking about the whole thing. So, I mean, I know it's, you know, your family, but I also tried to compare it to my life, and I realized how devastating that could possibly be, because it hurts you. I realized that if that happened to me, I'd be hurt so much as well.
It's freaky, and it's interesting because so much of our lives are wrapped up in mental health advocacy and in advocating for people with mental illness and trying to decide a balance between the seriously mentally ill and those in recovery. And all of the sudden, I realize that all of the other things that can happen in life, the bad things that can happen in life that have nothing to do with mental illness, right there on full display.
Yeah.
Right there. This was not a mental health issue. This was just a life issue, and it was not even on my radar. And not just because he was young, but because I just kind of think about every bad thing that can happen to me as being something related to mental illness. And this had nothing to do with it.
How is your wife handling it?
I mean, as well as can be expected. She's clearly grieving. And because of that grief process and of losing her father, she definitely shows, stereotypical signs of depression. And one of the things that we want to talk about on this show is medication. And a question that I get a lot is, oh, well, if your wife is depressed because of the death of her father, why can't we just put her on antidepressants and fix the whole problem up? And this is a very interesting thing for people to think, don't you think?
Yes, it is. Interesting. Just because, your father dies to just go on antidepressants. I mean, is that the best
what do they
decision?
think they're magic? I mean, they're magical pills, Michelle.
People think just like, oh, take this pill, you'll be better. I'm like, that's not how it works. It's a whole process. It's a very big process to get on the right medication. And if you think just like popping a pill is going to make your life better, you are sorely mistaken, because it is quite the process. I mean, maybe popping one pill at one time, maybe that would work for you. That would be amazing. But I could have to say from personal experience, that is not the case.
It's fascinating to me that people believe this about, antidepressants, antipsychotics, and psychiatric medications, because, aspirin doesn't work this way. You get a headache, you take a couple of aspirins, and sometimes it works and sometimes it doesn't. Sometimes you got to take more aspirin. Sometimes you need to, move over to, like Tylenol or something. It's just this idea that all people with mental illness have to be is med compliant and will all be fine. It leaves out some very important facts.
It really does. Well, what's really important to know is that you have to be med compliant on the right medications. Not every medication is going to work, but you have to test them out and try them out and see what works for you. And like you just mentioned with the migraine medication, aspirin and everything, why is there so many different headache medications that advertise so many different things if they all say they do the same thing? That means there's a zillion different antidepressants, a zillion different antipsychotics, a zillion benzos. I mean, they all react in different ways, just like a different headache medication would do for you. And if one works, if like aspirin works for you, it might not work for your friend. And the same thing for antidepressants and every other, antipsychotic medication that there is.
Isn't that amazing? Like people, you just nailed it. Like I'm giving you a standing ovation right now, Michelle, because there are multiple medications for headaches.
Yes.
But everybody's like, oh, you have a severe mental illness, a scary mental illness, this misunderstood disease that is stigmatized and discriminated against, and just go to the doctor and get one pill and it'll be fine. We haven't figured out how to do this for headaches.
I know.
But everybody in the world is just, oh, go take your med. And we're on combo deals. We're not like on a single medication.
Yeah,
how many medications do you take, Michelle?
Dude, the thing is, I take 7 medications.
Twice a day, right?
Well, no, I take 6 in the morning and 1 at night.
Yeah. I take 6 medications, and I take 4 of them at night and 3 of them in the morning. And you're thinking to yourself, wait, that equals more than 6. That's because 1 of them I take both in the morning and night. And I also have a pill that I carry in my pocket for acute panic attacks.
Same.
There you go. So there's yet another pill. And this is on top of just, being a 40-year-old man that, is probably someday going to have like high blood pressure and cholesterol because I do nothing but eat McDonald's. Who should sponsor? Ba-da-da.
Also, I should say, if you need a nice pill box, if you go to Schizophrenic.NYC, you can get these amazing pill boxes to put all your pills in. What I always say is that, being a schizophrenic, I couldn't find a pill box to hold all my daily pills, so I made my own. That's right.
Yeah.
Shameless plug.
Yeah. But if you want to save money, you can use a Ziploc bag. They're free.
Are you Lisa Rinna? Do you watch Housewives of Beverly Hills? Like Lisa Rinna walks around with a bag of pills. I have tweeted at her. I've tweeted at her about the bag of pills, and I tweeted at her the pill box, the Don't Be Paranoid pill box, and the sticker, and she tweeted back at me, amazing, or something like that, and then I took a screenshot, and I was like, Lisa Rinna tweeted at me!
Sweet!
Also, I just wanted to mention that 2 of the medications I do take are for side effects. So just because you take medication, yes, you get better, but there's also side effects that go along with taking medications. I think bringing one up that's important is akathisia. Akathisia is sometimes when you take an antidepressant, you suddenly feel like you're jumping out of your skin. You almost want to tear your chest open and let your heart free because you're just jumping out of your skin. You can't sit still. It's the most horrible feeling in the entire world. You just jump around everywhere. And I had experienced it in college when I was given one medication after I got out of the hospital. I took it once. I was jumping around everywhere. I had no idea what was going on, but I never took that pill again. And when I explained what I was feeling to my new current doctor, he said, oh, that's akathisia. What you need for that is this pill. I was like, oh, okay. Why did nobody prescribe me that pill when I was in college? That really annoys me. Because if I was just given that benzo that goes along with it, I would have been great when I was like 19 years old. But no, I had to wait till I was 22, 23 to find out I was experiencing akathisia on antidepressants.
That's because not everybody experiences it. For example, I'm on an antidepressant and I don't have akathisia. And I don't even know how to pronounce it.
But why did the doctor not realize? I called the doctor at the hospital and said, this is what I'm experiencing when I'm taking this pill. And they said, oh, talk to the outpatient doctor. I talked to
Are you sure that's an antidepressant symptom or is it an antipsychotic symptom?
No, it's an antidepressant symptom. Yeah. So
I did not know that.
I called the hospital. They said, call the outpatient place. I called the outpatient place. They said they didn't know. They said, call the doctor at the hospital. So there I was stuck in the middle of nowhere, and I just stopped taking the medication they gave me. Really great visit to the psych ward, left with no help.
And this is, let's focus in on that for a moment, Michelle, because one of the questions that persists in the adjacent community to mental health is, why do people stop taking medications? Why do people stop taking medications? Now, we are firm believers in our medication. We believe that it makes us well. Anybody that's been a longtime listener of the show knows that Gabe and Michelle are not anti-medication in any way. But listen to the frustration in your voice. You had this symptom not of schizophrenia, you had a symptom of the treatment, but you didn't know that. And then it scared you. So then you stopped taking the medication because you didn't know what was going on and you didn't know who to talk to, and you got caught in this loop. And people are just constantly saying, why don't you just take your meds? You were so dedicated and had so much support, and you couldn't find the right person to ask because you got stuck in kind of this loop. So imagine how somebody that's not Michelle, that doesn't have, good parents, health insurance, or doctors to even call, imagine how just how fucked they are.
Seriously, they really, really, really are.
Yeah.
Because honestly, when my doctor said he was going to put me on an antidepressant, I said, well, this is the trouble that I had with this pill. It gave me this feeling. He knew exactly what it was and says, with that, you have to take this. And I was like, okay, so I did it. Everything's fine. If I didn't take that other pill with it, I'm jumping out of my skin.
Well, and this isn't even to talk about the other popular, and I say popular just because it's somewhat well known, and I'm going to butcher the word, but tardive dyskinesia.
Yes.
I think I did it right. This is, if you ask somebody on the street, just a random person, what does severe mental illness look like? They will describe somebody rocking back and forth, somebody twitching, somebody whose legs won't stop moving. This is not a symptom of schizophrenia.
It's a symptom of an antipsychotic.
It's the side effect of a medication,
right.
But it's become so synonymous with the illness. And again, you ask people why they're afraid of these medications. This symptom,
the side effects, dude.
The side effect of the medication has become part of the illness in people's minds, and nobody realizes it's because of the medication. Now, we've come a long way since then, and we're not trying to scare people.
Yeah.
Make them afraid of medication. You need to work with your doctor. So let's talk about something more down to earth. A very common side effect of almost every psychiatric medication, sexual side effects. Or as I call it, dixafloppin.
Dixafloppin.
This is a serious side effect of mental illness. Now, Michelle, for real, we were diagnosed young.
Yes.
And I'm not trying to make your mother cringe, so maybe she wants to put her fingers in her ears. But you're diagnosed with mental illness between 18 and 24. And, I was sexually active between 18 and 24. And were you sexually active between 18 and 24, Michelle?
Mom, close your ears. Yes, I was.
Okay, so now all of a sudden you're giving pills that take away your libido. For me, it caused impotence. Sex is a good thing. We want to have it, and then we're given a pill that wrecks it. What is the number one thing that we do if we're taking a pill that kills our sex drive?
Stop taking it.
Right. What's the number one thing that we should do?
Take our pills.
Yeah, and we should report the symptom to our doctor who can help us. I'm lucky. I'm lucky because I was older. I was 25 years old. I was married, so that gave me some coverage. I'm a man, so all kinds of help there. So I just said to my doctor, hey, I started taking this pill and I'm noticing some problems down there. And my doctor was like, yeah, that's very common and helped me out. But, Michelle, speak to this from a female perspective. You're an unmarried 20-year-old woman and all of a sudden you're having sexual side effects and you have to tell your 60-year-old doctor that reminds you of your parents that you're not having enough sex. I mean, that's very difficult for people.
I would think sexual side effects for a woman is that it's almost impossible to arrive. And if you do arrive, it takes a very, very long time. So it's actually really, really, really frustrating. This
is like the most mature you've ever been. Arrive. I'm trying to be professional here. In the show notes, she write, didn't come. I mean, that's
not what I wrote, you dumb bitch.
PsychCentral.com is the internet's largest and oldest independent mental health online resource. Since 1995, our completely free, award-winning website has been run by mental health professionals offering reliable, trusted information, as well as over 250 support groups to people living with mental illness. From professional articles to personal stories, PsychCentral.com is worth your time checking out and is the generous sponsor of this podcast.
But sincerely, when people ask, why would you stop taking your medication? Most people of any age, if they started taking a medication that took away sex from them, whether it's because they have sex for pleasure, whether they have sex to show intimacy with their spouses or their romantic partners, relationships, etc., or for whatever reason, this is, pardon the pun, a bitter pill to swallow. And when we are unwilling to talk to our doctors about that side effect, we would rather stop taking the medication, declare that all medication did for me was make me limp. Just, again, sorry, Granny. But that's, again, I was lucky. I felt very empowered and I was comfortable talking about this. But I talked to a lot of people, Michelle, and the number one reason people go off their meds is not because they don't understand that they need them. It's not because they're afraid of them. It's because they had a sexual side effect and they freaked out and they didn't want to tell their doctor. So they just avoided the whole thing.
Were those guys you mostly spoke to?
Yeah.
Oh, okay. I mean, why I decided to first flush the medication that I first got down the toilet, because it just made me, like, more depressed. Like, I was never told that a side effect of antidepressants or mood stabilizers can actually make you more depressed. It was never told to me. So I was taking them, and I was just getting more and more down. But I'm like, everybody's not saying that I'm running around like a crazy maniac anymore. Like, is this what normal is? I mean, growing up with schizophrenia, never really knowing what's right, never being paranoid, not knowing what happiness is, I didn't know what regular happiness felt like. So, yelling and running around like a maniac, I was so happy. So I was like, yay, this is happiness. But to all the people around me, I was absolutely out of control. So I started taking this medication and I was quiet. So I was like, oh, I guess quiet is how you're supposed to be. But internally, I was absolutely miserable. And then, winter goes by, things happen. Like, we're drinking, I hurt myself, cops come. And then after that whole thing, pills down the toilet. And I said, I'm never taking medication again. That's when I was 18.
Michelle, I understand why you felt that way. This is one mentally ill person talking to another mentally ill person. You thought your life was going to get better when you were giving those meds, and something bad happened. You felt normal before the medication because define normal. That was what your life was like until then. You took the meds, and in your estimation, the world changed for the worst.
Yeah.
Your life in your mind, from your vantage point and from what you were used to, didn't get better. It was worse.
It was worse. I mean, I was also diagnosed as bipolar, which was not the right diagnosis at the time, but also I wasn't as honest about everything, and I didn't understand my own illness. I didn't really fully understand all of it, so I couldn't articulate it well. So I was diagnosed wrong. I was put on the wrong meds, and also the woman prescribing me the meds didn't even remember prescribing me the meds the next week when I went to go see her. She kind of said, "Oh, I wrote you a script?" And I was like, "Yes."
I mean, sincerely, didn't that kind of make you feel like maybe nobody cared?
It just made me think, like, does this woman even know who I am? Does she remember what I said to her last week? Because, like, I spoke to her and then she just said, "Let's get you on meds as soon as possible." That's really what she said to me. And then, I mean, after a bunch of things happened that year, I'm pretty sure she got fired because of my situation.
Well, let's put that aside for a moment. But this is an interesting point. See, I was prescribed medications at 25, and I looked across the landscape at all my other 25-year-old friends, and none of them were on meds. So they said kind of mean things like, "Oh, you got a pill case like your grandma. Oh, you remind me of my dad with all those pills." They weren't supportive. And that made it worse because they didn't mean to. They were just trying to be funny because they didn't know what to say. I want to make that very clear. I wasn't friends with a bunch of assholes. I mean, they were assholes, but not in this regard. They were trying to help. They just didn't know what to say. And the reason they didn't know what to say is because they weren't taking a whole bunch of pills. They didn't have a whole bunch of doctor's appointments to go to. They didn't have chronic illnesses. So I see why young people, when they start taking medication, they have nobody to get support from. They have nobody to get support from?
I mean, my friends in college always supported the meds. They knew that I needed meds and stuff like that. And when I finally got on my other medication that just kind of chilled me out, they were supportive of it. And even when I started taking it regularly, like I was talking about, I finally got over it. And I'm going to take my 3 times a day regularly, with my lacrosse coach. So because she kind of like gave me an ultimatum of sorts.
Right.
My roommate sat me down at lunch one day. Well, not sat me down. We're sitting at lunch and they're like, we notice like you're kind of changed. You've been acting a lot different, like a lot more calm, a lot more, just better. And I'm like, oh, well, I started taking my medication regularly. And they're like, really? That's the difference? And I'm like, yeah, I'm just taking it regularly. And that's why I'm acting like, kind of better. And they were like, oh, wow, okay. The only person that was kind of against the meds, sorry, Mom, was my mother. Because she would always ask me, why do you need this? Why do you take it? Why do you have it? And then after college, when I wasn't going to that doctor, I didn't have the meds anymore. And I guess I said to her, I guess I'm not taking them anymore. And her response was, good.
Hey, my mom did not exactly the same thing, but my mom used to ask me, like, are you sure you need this much medication? And, I had all of these, and she's like, well, what's this one for? Why do you need that one? Well, will you be able to... And I don't think that our mothers were trying to be mean. They're just... Most 20-year-olds aren't on giant piles of pills.
At that time, it was just one medication 3 times a day.
That's a lot of pills for a 20-year-old, Michelle.
I guess you're right. Yeah.
I mean, look at it from your mom's perspective just for a moment. I
guess she didn't want to see... I don't know what her perspective was. She didn't want me to be on medication. I guess she just didn't want to know that her daughter needed medication to live a normal life. But in turn, what that said to me was that she's not accepting me for who I am.
And both of those things can be true. And this is where we get in a lot of trouble when it comes to mental illness. Honestly, I don't know your family. I wasn't there, but I would venture to guess that much like my family, they just didn't want you to be sick. My family didn't want me to be sick. And, there's a lot of ignoring and cognitive dissonance that comes into why are people sick. So we start to look the other way. Kind of like we forget that maybe, I don't know, presidential candidates have done a lot of bad things because we like maybe one thing that they did. Stuff like that.
I mean, I love Demi Lovato so much. And just because she overdosed on a drug, I'm not going to judge her for being a drug addict.
But we do have to acknowledge that Demi Lovato may be a drug addict. And I know this is going to wipe her off of my number 4 list. I'm sorry,
I still love her. I was listening to her music all day yesterday.
Isn't one of her songs called Sober?
It might be. I wasn't listening to that one. I like Give Your Heart a Break or Skyscraper.
How does Skyscraper go? Sing it.
I'm not singing. Sorry.
You were singing before we turned on the microphone.
No. I'm not going to do that.
Okay, so one of the things that I realized is that I was so confused and I was going through all of this and my family was equally confused. And I talked to so many people, and so do you, Michelle. This is our job. It's to talk to people about mental illness. And what we end up with is a confused and traumatized person who was diagnosed with mental illness being taken care of by other confused and traumatized people who had their loved one diagnosed with mental illness. And all of us, because we don't have any education, we don't have any understanding, we don't have any resources, we don't have little pamphlets that explain how medication works, or pamphlets that explain bipolar, schizophrenia, depression, how it works in simple layman's terms. We should make those.
Yes. But I'm also saying every commercial you see on TV for a new medication shows you how this medication will help you. Say, oh, is your antidepressant not working? Try this pill with it.
Yeah.
Ask your doctor. It'll go great. Like, no, that's completely misadvertising. Maybe it'll help. Maybe it'll make it worse. But why do you have to ask your doctor? Your doctor should be recommending things to you. They're supposed to be the expert. If your doctor doesn't know about these other things and is not recommending them to you, you probably don't need it.
That's certainly possible. But in fairness, Michelle, to play devil's advocate the other way, look at how much we have learned about our illnesses, not from doctors or therapists, but from influencers and patient advocates and the patient community.
That is very true. That is very, very, very true. But I mean, I've spoken to people with other advocates of the patient community that take a medication that I may have taken in the past. And I'm like, oh, God, that didn't work for me at all. And they're like, oh, I love it. I love it. And I'll be like, oh, I take this. And they say, oh, that didn't work for me at all. And I'm like, oh, it worked for me great, you know?
Yeah, no, I agree. Because again, I swear by Tylenol for headaches. My grandma swears by Aleve for headaches. And, you know, my friend Lisa swears by aspirin. We all have
for me.
A headache.
Ibuprofen for me.
Look at that. All four of us have the exact same headache. Probably caused by me, because that's the commonality. Michelle, was it hard? Sincerely, this is a tough question. I want you to think about it for a moment. Is it hard to admit that you needed medication? I mean, you were an elite athlete. You were tough. You're brash. You're a badass New York chick. I mean, sincerely. And now you're dependent on a pill. Was it hard to admit that you needed it?
Honestly, okay. Summer going into my senior year of college, I was working in a sleepaway camp. I gave the medication to the nurse like all the little girls did. And I said, I need this 3 times a day. Will you give it to me 3 times a day? And I had the nurse giving me my medication 3 times a day. I had the best summer of my life. And then school comes around. I'm trying to do it 3 times a day, and I'm kind of messing up. But then after a while, you know, a few months pass by, and I'm like, you know what? The nurse isn't here anymore. I'm going to take responsibility for myself. I just got over the pride of not needing medication. I accepted it. I started taking it 3 times a day when I needed it. And then, like I always tell the story, my coach called me into her office. The assistant coach was there. They shut the door, and automatically in my head, I'm thinking, oh my God, just apologize. Whatever I did, just apologize. Oh my God, what did I do? Apologize, apologize, apologize. They go, you're not in trouble. And I'm like, okay. They go, are you interested in being captain this year? And I was like, what? What? And they're like, yeah, we really noticed a difference in you. Other coaches even noticed a difference in you. So we want to offer you the position of captain. And I was like, okay, yes. I was in such shock because when they shut that door, I thought I was about to get yelled at.
And you had to stay on the medication long enough to get to the reason that you needed to stay on the medication, because the day that you started taking it, that reason was not available. So it is somewhat blind faith. You have to hope that the medication will work and make your life better so that you too can become captain of the lacrosse team.
Right. I knew that when I took that medication, I did feel better. But the thing is, taking it 3 times a day was always my mess up, because I would take it in the morning, but if it would drop off before I took it again, I would say in my head, it would start going all nuts saying, you don't need this medication. Don't take this medication. You don't need it at all. Stop taking it. All those thoughts would come in my head. So I would time it to take it before those thoughts would come in my head. It was a whole timing process.
Michelle, you never cease to amaze me with your awesomeness. I myself never went off my medication because I had a lot of good people around me that warned me. And they told me in no uncertain terms that they would not support me if I quit my medication. They
even the floppy?
Yeah. No, I went straight to the doctor. And there's an example of where I had really good health insurance. I went to a psychiatrist. I got the medication. 2.5 weeks later, I had dixaflopin, and I immediately called my psychiatrist. I told him about it, and within 48 hours, I had a different medication. He called me back.
Oh, so you went on a different medication. You didn't take like a man popper.
A man popper, Michelle. A man popper.
That's what they're now called.
Wow.
Man poppers. Man poppers.
No. They were able to, because it was such a new medication, I was able to stop the dixaflopin medication, and I was able to go on one that did not have...
Dixaflopin medication, dick poppers.
No, Yeah, that's... I am glad that we have a show that is rated M for mature. I apologize to our family members that listen. Please go to Schizophrenic.NYC/WEGO and endorse Michelle, but really...
If you agree with dick poppin' medications, for sure.
All right, how are we going to end the show?
I would like to end the show just by saying, if your medication's not working for you right now, try something else, talk to your doctor, get it working right, and you can live a normal, successful life, love life, on good medication, and you're going to love it.
I love how we constantly use the word normal, Michelle. We should do an entire episode defining normal, and maybe we could have a t-shirt surrounding it.
That would be so cool, Gabe.
That would be really cool. Thank you, everybody, for tuning into A Bipolar, a Schizophrenic, and a Podcast, and we will see you next week.
Dicks a poppin'.
You've been listening to A Bipolar, a Schizophrenic, and a Podcast. If you loved this episode, don't keep it to yourself. Head over to iTunes or your preferred podcast app to subscribe, rate, and review. To work with Gabe, go to GabeHoward.com. To work with Michelle, go to Schizophrenic.NYC. For free mental health resources and online support groups, head over to PsychCentral.com. The show's official website is PsychCentral.com/BSP. You can email us at show@PsychCentral.com. Thank you for listening, and share widely.